Hi, my name is Deepika Malik. I'm Retina Surgery Associate at Ophthalmic Consultants of Long Island, New York. I'm here at Retina World Congress, and I'm presenting a case series of patients who had refractory macular hole and were treated with decellularized basement membrane with overlay tinting. The success rate of standard vitrectomy for idiopathic macular holes is about 90%. However, in patients who have large macular holes or chronic macular holes more than 4 to 5 years in duration, or patients who have macular holes which are associated with retinal detachment or posterior staphylomas, as in high myopes, outcomes can be very challenging. The success rate can go as low as 30 to 40%, or even visual prognosis is extremely limited. The epiretinal placement of amniotic basement membrane actually helps with the overlay technique, prevents the damage to the retinal pigment epithelium during the surgery, thereby it helps in reattaching the synaptic terminals of the photoreceptors to the RPE. However, it is very important to note that patients who have macular holes greater than 1200 microns in size, they may do better with arteriovenous retinal transplant. I try to reserve this technique for holes smaller than 1200 microns but greater than 800 microns in thickness. In my cases, I'm utilizing Biovance single layer and triple layer amniotic basement membrane, which is basically a decellularized basement membrane which has been stripped off of the amnion as well as chorion. Thereby, it makes the amniotic basement membrane anti-inflammatory as well as it is bidirectional. Given that, it is very easy to manipulate in the eye because there is no concern about which direction has to go up or down, and also the single-layer membrane is 13 microns in thickness, which is so much easier to actually insert through the trocars. I use basically 25 and 27 gauge trocars, both of them, and in both the cases, I have never had any issues inserting these membranes through the trocar. So in the case series of 10 patients that I'm presenting in the Retina World Congress, 40% of the patients actually were secondary repairs, and about 2 patients have retinal detachments associated with macular holes. 1 patient had pathological myopia as well and associated posterior staphylomas, and 3 patients were actually chronic in nature. So all of these patients at month 1 and month 6 had a successful anatomical closure. About 90% of the patients actually had 1 line improvement, and about 70% of the patients had about 3 lines improvement at the end of 6 months. Some of the key surgical pearls about this technique is to make sure that the retina is completely dry before inserting the amniotic basement membrane. I generally make sure that I wait for at least 5 to 10 minutes to dry the retina completely and then insert the basement membrane graft into the eye. The graft size I usually pick is about 2 to 3 millimeters, and once the retina is completely dry, the graft sits and adheres very nicely to the macula, and this actually avoids slippage in the postoperative period.